Hi guys, this is Lexi Albright with the Foundation for Skin Cancer Prevention, and today, of course, we're going to talk about preventing skin cancer. What is skin cancer? It is the most common form of cancer in the United States. It is the abnormal growth of cells in the epidermis, which is the top layer of your skin. The two most common forms of skin cancer are basal cell and squamous cell carcinoma, and these two forms of skin cancer are highly curable. The third most common form of skin cancer is melanoma, which is the deadliest form of skin cancer. If you look at this picture here, this is a melanoma spot on the skin. And skin cancer is caused by exposure to ultraviolet rays or UV rays that come from the sun. The UV rays reach the earth and they can penetrate the skin and damage the connective tissue and DNA of the skin. UV rays can also cause sunburns, change the texture of the skin, and cause it to age prematurely, which I don't think we want, and have been linked to several eye conditions. There are several risk factors for skin cancer, but the biggest one is anyone with exposure to UV rays is at risk for skin cancer, which is all of us because we all go outside. So, but other factors include those with lighter skin tones and skin that burns easily in the sun, and those who have a large number of moles, as shown in this picture. If you have a family history of skin cancer or even a personal history, which means you've had skin cancer previously, and those that are of an older age. Um, there are multiple signs of skin cancer, but the most common sign of skin cancer is a change in your skin, like a growth, a sore that doesn't heal, or a change in the mole. And warning signs to look out for in regards to melanoma, which you will want to look out for because it is so deadly. And they are referred to as the ABCDEs of melanoma. So the A stands for asymmetrical, like does it have an irregular shape or two parts of the same mole look different? And as you see here, if you look at this normal mole, it's very symmetrical, it all looks the same, but at the abnormal mole, you can see that this side is longer and this side is more squat and wide. So it's just a very irregular shape compared to this one. And the B stands for the border, like is the border jagged or irregular? Um, so if you look here at this mole, it's very even. It's nothing abnormal about it. But at this mole, you can see it's just the borders all over the place. Like it goes down here, it goes out here, really goes out here. So it's just very irregular and jagged. And C stands for color. Is the color of the mole even or not? So if you look at this normal mole, one color, nothing's really different about it. But at this abnormal mole, multiple colors. Very light on this side, very dark on this side. So it's very abnormal. D stands for the diameter of the mole. Is the molar spot large, especially in the regards to the size of a pea, which is about 1/4 of an inch as listed here. So at this mole, it's very small, definitely smaller, but when you look at the abnormal mole, it is definitely larger than 1/4 of an inch, and it looks like it would definitely be bigger than the size of a pea. And E stands for evolving. Has the spot changed over time? Has it changed in shape, color, size? And if you look at these moles, at first they're not evolving or changing. And then as time goes on, they do start to change where they're getting bigger and getting darker. So those are the signs for melanoma. So always be on the lookout for those. Now, what do you think you can do to protect yourself from skin cancer? There are multiple ways to protect your skin from skin cancer, like staying out of the sun between 10 a.m. and 4 p.m. because that's when the UV rays are at their highest, and wearing protective clothing like long sleeve shirts, hats, and stuff that protect your eyes, face, the back of your neck, and also wear sunglasses that provide 99 to 100% UV protection. Definitely avoid tanning beds because that is just straight UV rays going into your skin, and that's very unhealthy. Stay in the shade as much as possible before going out. Check out the UV ray index to see if there's anything you need to look out for. And lastly, but most importantly, wear sunscreen. Use sunscreen every day when you go outside and apply about 1 ounce of sunscreen 30 minutes before going out and then reapply it every 2 hours. Also, reapply after swimming, sweating, and toweling off because it gets wiped off and just washed off even. And use at least a 30 SPF or higher, really just depending on your skin tone. And if you look at this picture, you can see how much protection the sunscreen gives you from the UV rays. If you see this long dark strip, that is sunscreen, and that is blocking your skin from those UV rays, and it's very helpful. Now there's a little shadow trick I'm going to teach you. If your shadow is shorter than you, the UV rays are stronger. So if you see here, these shadows are very short, very close to you. But if your shadow is longer than you, the UV rays are less intense. As seen here, it's very long, definitely longer than him. So always be on the lookout for that, and you'll be able to see how strong the UV rays are. It is very important that you do protect your skin because any type of skin cancer, be it deadly or not, can be horribly disfiguring and painful. I encourage all of you to always be checking your skin for changes so you can catch it early so you can be safe. Because if you see here, this is because of skin cancer, and I just don't want you to have to go through that. Thank you guys so much. Have a great rest of your day. Bye bye.